Hi, everyone. It's just me today, Dr. Stephanie Canestraro. Welcome back to What Happens in Vegas, a podcast where I'll share with you everything that I've learned and everything that's moved the needle for me in my health after suffering with severe chronic illness, tentatively diagnosed as multiple sclerosis. Later on, finding out it was severe Lyme infections that stayed in remission for 10 years and reemerged in the COVID era. So, speaking of that, I want to talk to you today about something called chronic toxic syndrome. And that's just a name that we quite frankly made up. And it's what we've been seeing and who we've been helping. It's almost like a spectrum of how many symptoms that you can have, but all of them come back to the same thing. And we've been seeing these emerge more and more in the last 5 years. And if you've listened to my podcast in the past, then you know that I talk a lot about the changes that happened 5 years ago. And some of those are release of non-native, novel, direct wave EMF known as G. We are frequency beings. We give off a frequency. Every cell gives off a frequency. Every single thing on this earth has a frequency. We know that there are healing frequencies. There's something called a Rife machine. And lots of people have harnessed these different frequencies to treat the body. By putting a frequency through the body, you can kill specific parasites. You can help heal an organ because you're giving off the frequency of when that organ is healthy. When we're unhealthy, we lose a frequency. It can be measured. So I think that that's really important for people to start to realize, and why I want to reiterate it time and again, because we're in this era where there's a huge change in all of this electro smog and these frequencies coming at us. Now, if you're someone who already knows that they're sensitive to EMF, like I was, I've become less sensitive by lowering my toxic load. And the thing is your toxic load can be pretty buried, and your toxic load becomes more of a burden if your immune system or inflammation goes off kilter. And that's what's happening with a lot of people. We're reaching our tipping points. I've reached my tipping point twice in my life. Once in 2010 or 2009 at the end of chiropractic college, when I had honestly textbook Lyme neuroborreliosis. So if you were to look that up in a textbook, what an acute infection is of that is, I had the Bell's palsy, I had a traveling rash, I had severe anxiety, I had sense of impending doom, I had neuralgias and paresthesias, and I had pain traveling in my body. I had severe vertigo. My symptoms would change so much because Lyme can travel around the body within seconds. Lyme also has co-infections that were never diagnosed for me. So at that time, I was told I had multiple sclerosis, and I was only taken seriously after things got really bad. And a lot of you have heard that story, but it's a big integral part of how I became so interested I was always interested in the human body, but even more interested in human physiology and biology, and why we feel what we feel and why it's not being properly explained to us. So an example, when I was going through these severe nerve symptoms that were disappearing and reappearing, like not being able to move my arm, having Bell's palsy, but then getting the movement back, and go in for a nerve conduction velocity test and an EMG where they stick them big needle in your muscle and you have to contract them. And they found the fasciculations, which I told them I was having, which is when your muscles twitch. They said I didn't have any damage to my muscles. So by the way, for them to get a reading, you have to have about 70% of loss of one of your nerves for it to come up, especially for the nerve conduction velocity as damaged. Like, obviously we want to figure out things before that. And there has to be a why. My gut health wasn't great, but my health went from I'm a normal person to something got turned on. And I had to do a lot of researching down the rabbit hole after that. And I had been bit by bed bugs, and bed bugs are vectors that can carry disease. And people don't talk about that. But anything that stings you or bites you can be something that carries these chronic low-grade stealth infections. And the reason I'm talking about those chronic low-grade stealth infections is because mostly all of us harbor them. No one has a perfect immune system. People can have EBV, Epstein-Barr, which is mono from years ago, and it can stay in remission in the body. A really good example that people can understand is things like herpes, where you can see the cold sores come out, or shingles, where you can see that there's been a virus dormant in your body. And usually there's some sort of stressful situation on the body that makes these things start to be able to replicate and get out of their almost hibernative state. And I did a post not too long ago on Instagram talking about Lyme disease and talking about how Lyme is a shapeshifter, which means, and this is multiple bugs can be something called pleomorphic. And pleomorphic means they can be in your body and not harming you at all, or they can become opportunistic and become a huge, huge problem. And that is what's turning on for people a lot in this day and age, with everything that we're inundated with, from all the chemicals that are being created faster than we can adapt to them, for the the EMF that's coming at us, for these novel viruses that are coming at us that have created a ton of inflammation in the body. And you can say the train, and people can think that they're not prone to this, and it can be very humbling. And I've been humbled. I went through this before. I didn't think I would ever go through it again, and I definitely didn't think if I went through it again it would be worse and so aggressive. So I've been through it. I've been going through the ringer for the last 5 years. In November 2021, Lyme, which I didn't even know for sure. I never got a full diagnosis of Lyme. I never tested. I had some muscle testers, which are people who measure your muscle strength when they put like the Lyme frequency on your body. I've been told that I had it harboring in there, but I never had any more symptoms since 2010. I did a parasite cleanse at that time. I found out I had celiac disease. I healed my gut as best as I can. And in that way, I healed my brain, and hence the Vegas clinic, and hence how I was working with different athletes and helping them fix their gut to protect their brain, and why we're still doing that. But in the last 5 years, things have become very urgent, and there's been a novel virus. There's been new treatments for that virus, or prevention, that seems to be more toxic than the actual problem itself. But what we have to understand is, first of all, these things can be fixed. But first, I'm going to talk about some symptoms that people have been going through. Okay, so this is all with or without cardiac symptoms. For me, I had cardiac symptoms for the first time in my life. Severe heart palpitations where I felt like I lost my breath. I had severe high blood pressure, hypertension, pain down my left arm, just like the feel of impending doom, which can be your cardiovascular system, is a very common one. It's a terrible feeling. The feeling that your heart's thumping out of your chest, even though you're resting or laying down. Even swelling of the arms during the night is a cardiovascular symptom. My legs were turning purple because of not enough blood flow for multiple reasons, but a big reason is how it affects the vagus nerve and our ability to regulate our nervous system and regulate blood flow to different places. And so in this chronic toxic syndrome, I'll talk about the causes, but first I'm talking about the symptoms. So I mentioned the cardiovascular symptoms. The other symptoms that people are feeling is this severe anxiety that just takes over them, where they want to literally jump out of their skin. And the heart symptoms and that jumpy out of your skin feeling, what has relieved people is working on cardiovascular, clearing lymphatics around the chest cavity, in between the shoulders, in the quadrangular space, which is the back of your shoulder, in your pecs, down your biceps, in all of your neck, where all of your lymphatics clear. Lymphatics are hugely important in this. So the other thing people are getting they can get severe vertigo. They can get numbness and tingling in their body. They're getting blood pressure changes, so fainting or feeling like they're going to faint, or just drop attacks in general. A lot of this happens in the driving position, so people having to pull over to the side of the road because they're feeling like this, or they go into a grocery store and the lights are making them feel crazy. There's been severe headaches coming along with this. And a big thing that we've noticed is a change in bowel function. Either it speeds up really quick and then eventually slows down. A lot of abdominal pain, especially at different valves, because it allows these parasites to turn back on, which block these valves. We've seen a lot of organ pain, which people don't know are organ pain, but the liver pain is the aching and throbbing kind of under your right rib cage. The gallbladder liver can refer up to the right side of your neck into your right shoulder. The kidney, which can wrap around to the front, and it can be either one-sided, but it's considered flank pain, but you can feel it wrap around to the front, maybe into the front of your hip. and it could be one side or both sides. A lot of cerebral spinal fluid dysregulation of the pressure in your actual CSF, which is that liquid that runs in your whole spinal cord and around your brain and keeps it insulated. That cerebral spinal fluid becomes inflamed. It's inflaming the dura around it, and people are getting wry neck. They're getting lots of neurological, what seems like disc herniation problems. And then if they get an image, it doesn't seem like there's much of a disc herniation. Same with pain down the leg, pressure, a lot of hemorrhoids, recurrent UTIs. I mean, but it's just some of these symptoms that switch places. There can be pain in the shins, cramping in the calves. It's that electrical feeling, like there's too much electricity stuck in your body. Something needs out of your body. These are all part of this chronic toxic syndrome, and I'm missing a lot. So I'm actually just going to refer to a presentation that I did so that I can not miss anything that people are going through. Night terrors, morning anxiety is changing the way we breathe. There's been a lot of problems with all of a sudden people that never knew they had a tongue tie are getting these symptoms of anxiety or swelling under their tongue, or they're not draining from their neck. There's a huge drainage problem. So that can equate to all of a sudden you start snoring. All of a sudden you are waking up with this morning anxiety because you're not getting enough actual oxygen at night. A lot of this, like I'm going to tell you, is going to refer back to the fact that there's a big histamine load that comes from this toxic syndrome. Depending on where your lymph is stuck, there can be intermittent numbness there. A big common place is, this low back pain that's pretty acute because there's something called sacral edema. So you're almost swelling around your back and it's not being able to drain to the front and go through the proper exit through your body, through our cisterna chyli, which is the major drainage for our lower body, because there's so much stuck up here. So the chronic toxic syndrome, a lot of the symptoms come from the lymphatic stagnation. Brain fog is obviously a huge one. Some people get hair loss. That's a big post-COVID thing. We talked about the cerebral spinal fluid, decrease in muscle tone, followed by specific weight gain, overstimulated and general feelings. Chronic sinusitis can be one of the starts of this. Episodes of the body shaking, like really kind of shaking, which is tied to a specific parasite, which we'll talk about. A lot of like heartburn and acid reflux coming up. A lot of problems swallowing because of the migrating motor complex. That's what brings everything down. Floaters in the eyes is huge. People's faces looking more swollen, especially around the eyes, and that face of someone who's like in pain. A lot of like sudden patches of gray hair, sudden itchiness in the eyes and ears going along with that kind of histamine reaction. We're seeing a lot of common findings too in these people. A lot of the times we're seeing an imbalance in neutrophils to lymphocytes when we look at their blood work, which when you do your white blood cells are your immune response. A lot of those are being flagged as low. With the people who are really acute, we're seeing them flagged as high, so there's an active infection going on. But then over time, what we're seeing is like a lower neutrophils and higher lymphocytes. And usually your neutrophils should be higher, double your lymphocytes. So that's something that we're seeing. Hypercalcemia. So we're seeing high calcium in people's blood. We're seeing with that high calcium comes hyperalbumin. So too much of this carrier protein that's trying to protect you. And along with this, some higher cholesterol, either high ferritin or the ferritin tanks, definitely high heavy metals in almost everyone that has this syndrome. Definitely a component of mycotoxins, and then some component of stealth infections. So that I'm talking about Lyme disease, which is from the bacteria called Borrelia burgdorferi, or from its frenemies that we call Babesia, Bartonella. Babesia is a parasite, and it can cause a lot of heart symptoms. It can cause shooting pains in the body. It can cause severe anxiety, shakiness, enlargement of the spleen, stress on the liver. And Bartonella, which is a bacteria, but very similar. And the way that they change our immune system makes it impossible for us to fully fight off anything. So we start getting a buildup of different stealth infections. Our viral load goes higher. So things that we've kept in check before, like EBV, which is Epstein-Barr virus from mono, cytomegalovirus, all the different herpes viruses, HHV6, HHV7, which usually are put into check in childhood, different herpes viruses like cold sores or genital herpes. So we're seeing a lot of reemergence of these problems, and then the lymphatic stagnation that they cause creates this huge histamine response, dysregulates, uses up all our minerals. We're getting collagen disorders. So people are becoming lax that used to be very tight, or they're tight in certain areas. And now all of a sudden, even their organs aren't staying in the same place. Even for myself personally, I got a hiatal hernia based on this. So there are ways to fix all of this. But first, we have to identify where the bigger problems are. I mean, we can generally detox and lower things. We can, we can back off of EMF as much as we can and ground to offset all of that dirty electricity going through our body. When you ground, you absorb electrons and you detox out the positive ions in your body that are toxic and creating an overstimulation. You can hyperoxygenate. You can use things like breath work. There's now different waters that are hyperoxygenated. You can get hyperoxygenated baths. We have supplements that have oxygen carriers. We make sure our mineral balance is high enough so we utilize oxygen properly and we don't stay in an acidic state. Obviously, our diet, we want it as clean as possible, but let me tell you, half the people that I see are eating the cleanest diet, or they can barely eat anything anymore. So these can all be turned on by mold, right? Mold got stronger with all of the EMF exposure. So mold now gives off 600 times more spores. That's what makes it detrimental to us. Some of us have mold within our body already. So now we're getting exposed to the 5G, and they say, these direct waves aren't unsafe to us because they only can absorb 1 millimeter depth, 2 millimeters. Well, your skin houses your sweat glands. Your sweat glands are like antennas to the rest of your body. So these waves are getting access to the rest of your body, and they're aggravating mold. Who knows what they're doing to these other pleomorphic organisms? And that started in 2020, the same time COVID came out. So how can we differentiate the two? Now, with a COVID infection or someone who has that same particle found in their body, you can see a lot of this kind of symptom patterns turn on. And, lowering the spike protein or the waste in the body has a specific things that work for it. One of them being augmented NAC, which we use a lot of. There was research on Japanese knotweed, on certain antiparasitics, on, things that break them down like systemic enzymes. There's a lot to work on to lower the actual spike protein. Lots of antioxidants help for that. And more research is being put into that. But we need better ways of testing for people what their levels are, showing that they're lowering and starting to see, are they getting better? What are the changes we're seeing? What is in the people where this really affects them, and why some people are just handling it like it's a regular cold and flu, or handling the injection for it better than others. We need to start researching this. And I think we have some ideas. If we looked into the detox, we can look at someone's genetics and look at the detox patterns that they have. Do they have MTHFR? Well, that's one of the main ones, but do they have SNPs there? So they have problems with detox in that sense. Do they have problems with glutathione or recycling homocysteine? We have to learn these things about people. We have to see who's at higher risk, and we have to support them and prevent beforehand. And even sometimes when you support and prevent, life still gets you, but you have way more of a chance of protecting yourself. Another thing that we found, and why we're doing a course on lymphatics, which I apologize for the length of time for it coming out, but when you want your course to be really far reaching and really, really, really to the point, sometimes it's hard to find the right people. So we're working on that. We're going to have that out for you, but making sure your lymph is moving, like manual moving of waste, especially if you can't exercise because this has got you in so much pain or so much fatigue that it's not possible, then, there's PEMF mats, there's put a better frequency through your body to help it heal. There's a watch that I'm now using on myself that gives off frequencies and helps you negate bad frequencies. And it's an easy to use watch. It has all of these frequencies preset. It's not attached to EMF. It's just a watch that you charge that has preset frequencies. So there's a lot of ways of dealing and getting through this, but we definitely are seeing an uptick in these chronic symptoms. And I'm not just seeing them with really sick people. These are young people that were completely normal. These are some people that are elite athletes. And we're seeing that there is a lot of waste accumulating, and it can come on as simple as a night out with too much alcohol. We've seen turn it on, a mold exposure, turn it on, a really stressful traumatic event, turn it on. So That's what we're seeing in general, is often overlooked. There's a saying by a famous doctor that treats Lyme that he's seen a lot of patients that have Lyme that have never been bit by a tick, but he has no patients that have Lyme that have never been bit by a mosquito. So you have to keep in mind that there's these other vectors that are introducing us to these diseases, and sometimes they fester and we don't get even the acute infection like I did, and it just turns into a chronic low-grade infection, and or your body keeps it at bay until something goes awry. So that's what we want to avoid. That's what we want to avoid in people. And there's a huge peptide movement right now. Peptides can help your immune system that's been dysregulated by these bugs, things like thymosin alpha, thymosin beta, LL37. There's ones that can support your mitochondria for what happens to your mitochondria. There's ones that can help histamine. So it's a complicated, complex illness. So things that helped me, there's numerous things that have helped me, but having lymphatics move properly. So neural therapy are injections of something called procaine. They can do these little bleps, like they almost look like bee stings, down your neck, across your collarbone where all your lymph drains, and that can open up and give you a sense of relief so that you can go take the herbs, take the medications that kill the bugs without flaring up your symptoms so much that you can't handle it. There's different oxygen therapies. I personally have the oxygen bath by Bimini. My very first bath that I used was Cocoon, and that's in Las Vegas, but they have a few other locations now. That's KAQUN. Things that increase nitric oxide. Right now I'm taking the N101 product because my esophagus was affected by all of this. But there's a lot of people going through those same things. Hernias, all of a sudden can't swallow, pain in different valves in their stomach, just like excruciating pain by their belly button or a certain spot. Like one guy has his spleen specifically. It depends where these things are stuck and what organ they're jamming up. So we need to think fluid movement. We need to think hydration. We need to think minerals, minerals, minerals. So minerals are getting depleted. We use them up a lot because of the imbalances from a lot of the electromagnetic frequencies. So those are a staple. Things that supported my heart were things like hawthorn. It helps, like it's a heart tonic. I use different homeopathics to drain my heart. So the pecana ones that drain the heart area. People's lungs get missed if they don't have a cough. Like sometimes you can just have this like excruciating pain across and around your ribs. That's a big sign of Lyme being one of your co-infections. It creates this almost like, they call it the Lyme hug or MS hug or EBV hug, but really it's your organs referring, and you feel the wrap around and you feel terrible, and your neck can get the same thing when you have that, but you also can have the cerebral spinal fluid issues. So we've learned the hard way through experience how to relieve those things in people, but there needs to be some training of practitioners around the world so that we can help people severely suffering with these things. I've had patients have amazing results with something called ionosphoresis, where they filter your blood and they can show you in the dirty plasma that gets left over, all this foam and heavy metals that come out, and people have like these great healing stories. For me, an IV of silver, gold, platinum, chromium, some other things that sound toxic like titanium, with some NAD, with some magnesium and a few other things, B12. It created this huge immune response for me. I had a severe fever for 3 days, and then I felt like 90% better after that fever passed. Binders, I talk about that. I really couldn't have survived this without them, quite literally. Yeah. Chronic toxic syndrome. If you're suffering with this, we can help you. There's other people that can help you that I trust and think are amazing that we can suggest if we don't fit. But this is something I'm passionate about helping people with because it took away 5 years of my life. There 5 years of hard learning helped me search for answers I maybe wouldn't have otherwise found. But anything to pull toxins, saunaing, oh my gosh, sauna plus with the infrared light. If you guys saw the studies on sauna, you would just be blown away and wonder why you're not sweating once a day, because it can cut all-cause mortality in half because you can sweat out a lot of heavy metals and environmental toxins. I didn't even talk about all the pesticides and stuff we get exposed to that, don't hurt our cells, but they hurt our microbiome. And our microbiome, when you eat a toxin, it's bugs that have to break it down, or else it just gets stuck in your cells for the ones that our liver can't excrete. And there are a lot of those that our liver can't take care of, but our microbiome can. So now you add things like Roundup or glyphosate to the problem. And Roundup is, people spray it on their lawns. I think they're crazy still. It is the most toxic thing for your microbiome. It's in Roundup Ready corn. It's in all of the foods that aren't organic, even though it's banned in every other country other than North America. And the way it affects people, or affects the things that it's killing, is it blocks something called the shikimate pathway. And humans don't use that, but the bugs in our gut do. So now we take it in orally. The bugs eat the food that has the pesticide on it. Those bugs die. And those bugs could have been the bugs that help you break down a heavy metal and turn it into partially B6 or another vitamin. Like, it is magic what these bugs can do. And we're killing them in our soil too, like the microbiome of the soil. There's a lot that we're doing wrong, not admitting to, in the name of the bottom dollar. So these are the things it can cause. You saw putting someone on an HMET binder that binds up glyphosate. People who were infertile have more of a chance of being fertile. Another stealth infection can cause, if you're having multiple miscarriages, you should look into toxoplasma. Toxoplasma is what they want you to stay away from when you're pregnant. If you have a kitty litter, they don't want you to change it. Well, you can have that stealthily in your body. And if it happens to be in the uterus area, then you're going to have multiple miscarriages. I had it in my brain. I can tell you that because I went from a normal person to an insane one. And I believe it's what was killed by the last IV, because my spine felt like it was going to literally explode before I felt better. I had severe meningitis, almost meningitis-like symptoms. So yeah, so you can take binders like humic fulvics or other things that bind up glyphosate and have a higher chance of fertility, just as one thing, but there's multiple other things that can protect or help you become fertile, and men need to do them too. So that's a big thing that's missed, but this isn't about fertility, but that is just something that's part of this chronic toxic syndrome, because when you're toxic, your body doesn't want to procreate, right? It wants to keep you alive. And if it's hard for you, then one of the partner's bodies, they're trying to stay alive, and you have to find out what is drawing down their vitality. Chronic toxic syndrome, let's review it. It can be a plethora of symptoms. These are the most common symptoms that we've seen are these heart symptoms, these palpitations, this tachycardia, this heart thumping, this feeling of impending doom, this want to jump out of your skin anxiety, this arm swelling at night, this waking up gasping for air at night. We're seeing a lot of the migrating motor complex go down, or seeing a lot of different valves being affected, and lots of abdominal pain and swelling. Different than when you just have diarrhea and you're bloated and then you poop and it's better. This is just, it stays all the time. It's not affected. It's if you fast, maybe you feel better. Tingling, chronic pain in general, this histamine reactions, like, again, so all of a sudden you never had POTS and now people are telling you have POTS. Like, POTS is postural orthostatic tachycardia syndrome, but that's usually when you're changing postures. So people are just getting these symptoms when they're laying down, and all of a sudden they're dizzy and their heart's going crazy. So it's just an autonomic dysfunction, right? So there's a lot of autonomic dysfunction and under that umbrella, and that can be from the histamine, from all the other toxic waste. The histamine is high because you're trying to clear the toxins. Your lymph isn't moving and you can't. And your lymph builds, and when you feel your lymph in the middle of your eyes, that's when your eyes get wonky. And if it's pressure in the ears, sounds are bugging you all of a sudden, you got to clear the face and you got to clear the head and you got to do tongue exercises and work inside the mouth, and you got to drain the neck and you got to drain the chest and you got to drain the bowels. It's a drainage problem caused by these bugs. Breath work, how does it help so much? Because it's pumping that lymphatics. There's just so much lymph throughout your ribs. I mean, if you get that pumping, you're going to get it out. Part of the symptoms was different swelling. I had a gigantic left breast. 75% of your body drains into the left. It's not just a coincidence that that's what was huge while I was feeling swelling in my arm and all of that. And so I massaged the lymphatic areas and I helped clear it out. But stuck lymph in different part of the body can feel very scary, very sore, cause a lot of problems, and it can't be imaged really well. Even with these lymphatic imagings, lymphangiograms, which no one's really doing, there are some like heat signatures that they can do, but doesn't always equate to what you're actual feeling, although it often does. So once your lymph is like a river, if you create too many ponds or stagnant areas, that's when you get the overgrowth of toxins, and things can start to fester. So we need to get the immune system up. We got to support the mitochondria. We got to make sure the histamine is controlled. We can do this in ways not just with supplements, but with lifestyle, with manual therapy, with hydrating properly, with getting our minerals up to par, with supporting the basics, like making sure you have enough vitamin A and zinc and vitamin C, like those things that are strong for your immune system. Because we're seeing this immune decline and it needs to be supported. There's mushrooms that can support it as well. There's so much magic in nature and we're not taught about it anymore. And there's a time and a place for pharmaceuticals as well. There's a time and a place for other interventions as well. But there's some magic stuff people are doing. There is an answer to your problem. Topically, you can help yourself with a plethora of different things internally. So that's what we teach people. We have some guides that you guys can check out. We have videos on YouTube. We're really trying to get out more to explain. I've told my story over and over and over again. I'll talk about it more and more just to get it through because there was almost every organ system was affected in me at some point in time. Liver support is huge. The liver is our number one detox. We detox also through our skin, through our breath, through our urine, anywhere way we excrete. So open those things up. Make sure you're pooping every day. Liver cleanses, very helpful and a little bit aggressive for some people, but there are gentle ones. There are so many ways to heal. You can find yours. I found mine. There's plenty of different things. I was willing to try anything so I could share it anyways. People always talk about how much they spent on their chronic disease and, we spared no monetary or time based on what I could handle. So we can help you. And if we can't, we'll find someone who can. Immune modulation, we need to talk about really quickly. You can go into all of these. We have podcasts on LDLs, low dose immunotherapy. We have a podcast on neural therapy. We have a podcast on oxygenation. We have a podcast on nitric oxide. We have a podcast on all the other machines that I used, Flex Beam. We have a podcast on sauna with Sauna Space. I love their little hemp thing. There's also Therasage, and then there's also the actual installed ones or outside ones. So get saunaing, get drinking your water, get taking your minerals, get castor oil packing on your liver, get eating bitter foods, get doing your breath work, do the fancy stuff if you need to. Look into peptides. They can be really powerful signaling molecules. Look into all the machines and try them out and see which ones help you the most. I'll tell you, practicality is a big key. So my watch that gives off the frequencies called the Wave Watch, that you can put a frequency to kill Lyme, or if you have a sore throat, there's a frequency to fix that because there's a frequency for microbes in your gut. That is practical and moves the needle for me. The Flex Beam is practical and moves the needle for me. It helps me get over a lot of symptom patterns, gives my mitochondria the energy they need to heal. That was a must. My PEMF mat, I laid on there and changed my life. Sauna, heating up the cells in my body. Bugs don't like that, but also it helped my organs feel a lot better, helped things drain. My oxygen bath, if you can't buy one, find one around you. My foot bath, those are two things that are a little bit less practical because you have to set them up, but still really helpful. And if you're not feeling well, you will do these things. That's when people take action, but the time to take action is now. You can prevent everything that I've just talked about. Try to control stress. Vagus nerve stim really helps people. I have to say the electrical did not help me when I was already feeling very electric. I didn't want to put a buzzing frequency on me. FSM helped me a lot. That's a frequency specific microcurrent. So frequencies help me a lot. Manual therapy is up there. And it's not just because I do manual therapy. Silver killed a whole ton of stuff, brought me to a new level of healing. Oregano, even though it burned my esophagus because it got stuck on a hernia I didn't have. Todka saved my liver and all those other liver supports. Binders, an absolute crutch. Find one that works for you. We love Toxicity. We love Humic and Fulvic by Mother Earth. We love all the cell core binders. We love Pactisol. We love GI Detox for certain people. We love Chlorella. And these things are necessary in our toxic world. And someone who tells you that they're not, or tells you that they're giving you heavy metals or gives you some BS like that, well, we have tons, hundreds and hundreds of retests on people where they're getting less toxic, where everything is starting to look better and it's going along with their symptoms of feeling better. Anecdotal evidence, time and time again. How many times that you have to have? How many anecdotes do you need so that it's a real study? I don't know. But logic is fast, science is slow. So use that logic, follow your gut, and reach out to us if you need guidance. This was kind of a random one. I was trying really hard to explain to you this chronic toxic syndrome that we're having, but just know that if you're having weird symptoms, they're traveling along your body, you don't have answers, there are people that have answers for you. Even if it's not us, we will help you find them. So please, please reach out. Let us know how we can help you, and we'll go from there. Thanks for listening. Hope that was helpful. I hope if you have questions, you reach out. I answer my DMs pretty well if I see them. Thank you for spending your time listening to me. I know sometimes I can just ramble. Take care.